Good morning, everyone. I'm just going to go straight to the talk. So AMD still remains the biggest cause for macular degeneration, the wet form. Other causes are well recognized, but do we know what's the incidence of CNV after vitrectomy? So I'm going to just present two cases that I've encountered recently. So this is a 62-year female Caucasian, 3 history of macular hole. Standard case, as you will see in your VR, sort of a case mixed clinic, goes through a combined phaco-viti peel and uneven full surgery. So these are some pictures, right eye, pre-op, just for a comparison in the other eye. We can see some drusens there on the pictures. Okay, this is a 2-week scan followed. If you look closely, scrutinize closely, difficult to say, but there may be some sort of a signs there early, but difficult to pick, easy always on the hindsight. Now when this patient comes, so our normal protocol is patient comes 2 weeks and then sort of 6 to 8 weeks after the 2-week follow-up. So we see this patient at 2 months' time. There is already a red flag there seen by the consultant that this looks a bit unusual CMO, looks like CMO, but there's some sort of already some fibrous tissue. Okay, let's go with the standard therapy. Start with the ocular Maxidex, 6 weeks, no response, go for an Ozurdex. Patient receives an Ozurdex. So this is post-Ozurdex, not much response, still the same. Then we decided to do a fluorescein angiogram. So if you can see, there is a CNV coming there. And if you just sort of, just out of interest, scroll through the whole of the scan here, there's no trauma as such to the outer retinal tears, which would account for it. Receives 3 standard Lucentis, still no response. Okay, let's switch. Maybe it's a resistance. Try Eylea. Okay, no response with the same. And just as sort of how did the vision behave? So vision, even though there was a cystoid macular edema, remained unresponsive. Vision remained pretty steady, though it was less than before she started with the operation. On a similar line, case 2, again 74-year-old male. This time surgery for ERM. It's a pseudophakic eye, low myope, takes treatment for glaucoma. Going through very quickly, simultaneous presentations. You look through it. Yep, this is 2 weeks scan. There was no gas used. Some sort of a swelling over here. But this time we were probably visor. So we didn't classify it as a CMO as would normally do, went straight for a fluorescein. And the signs were that there was an RP proliferation there. So you can see a classical CNV. Okay, treat again, 3 Lucentis, same results, no response. Visions deteriorated from where we started. So in summary, 2 cases, uneven full surgeries, CNV diagnosed, or CNV was there within 3 months, and they don't respond to, the first one didn't respond to the usual cocktail and also to anti-VEGF. So few discussions. I don't know if anyone in the audience have similar experiences, and what is the incidence for these kind of cases? Also, do we classify them as iatrogenic? Though there's no trauma, but if you look to define an outcome in any VR surgery, in UK we use 2 months for retinal detachment, successful, unsuccessful. Okay. These cases are coming as well. I'm just on the last slide. Some surgeons use a sort of a IVTA after surgery, so that may mask some of the patients which may be sitting in your clinic. Maybe the inflammatory cascade is causing it, and increasingly we are operating on elderly patients which are more predisposed to developing CNV. So have a high index of suspicions in these cases.
Thank you so much. Question?
I have a comment on the unresponsiveness of the CNV to anti-VEGF. Could it be not unresponsiveness, but since the eye is vitrectomized, the duration of anti-VEGF may be, not enough to see the next month? Did you check the patient within 1 week or 2 weeks after the injection? Because they may need more frequent injections.
I take your point of the absorption in a victimized eyes, but these patients had 3 serial scans every month before the injections. But in interest of time, I just showed the 3. There was no response at all. So no, not 1 week. Yes, we had 4-week scan after each injection, but no response.
Maybe to check within 1 week may give an answer to you.
Okay, thanks.
Second question.
It's more comment. The thing with the 1 week checkup would be a good idea. And if this also shows that there's no response, maybe it's not VEGF related, this CNV. That was my conclusion about that there's so poor response, that it's something else in the pathogenesis which is independent to VEGF. So then anti-VEGF obviously won't work. And one more very short comment. Professor Einar Stefansson from Iceland, he said once in a big meeting, I have never seen a patient with AMD after vitrectomy. Maybe you want to contact him and discuss it with him, because he said it like openly, like anybody here in the room has seen it, and now you're the first one reporting it, and he is a man who knows a lot about this disease. Thank you.
Okay. No, thank you for your comments. I think we are struggling with 1 month people coming back to the clinic. We are so overwhelmed with the AMD work, so it will not be possible to do 1 week scan, but I take your point. And also, yes, I agree, it may not be an anti-VEGF dependent, that's why I put it could be an inflammatory, but we do use subcon steroids after surgery. So still, whether that's truly masking the effect or not, I don't know.
Thank you so much.